You mix and match the type of vaccines you get. We've heard from healthcare officials the answer is no. You must get the same brand of shot. However, an Orange Grove couple says they were given the Pfizer booster despite originally getting Moderna. Our Bill Churchwell spoke with the couple, who has lots of questions now. He joins us with what he was able to find out tonight. Hey, Bill.
Hey there. Yeah, tonight I also reached out to a local doctor who says that she has heard of other cases where vaccines have been mixed. However, health officials say there just isn't enough data out there yet on what kind of effects it could have, and they still strongly discourage mixing the vaccine brands. JD and Betty Doff were among those who came out to wait in those long lines at the Richard Borchard Fairgrounds when the vaccines first came out.
We went at 10:30 in the evening and were lined up at the end of a 2-mile stretch of cars.
The couple got the first dose in January, their second dose in February from the Corpus Christi Nueces County Public Health District. The type of vaccine was
Moderna.
Fast forward to August 19th and a trip to the CVS in Mathis, where JD and Betty say they were asked by an employee if they wanted to get their booster.
Well, yeah. And she says, we'll stand in line right there. And we had our cards, and that doctor gave us a shot.
But take a look at their vaccination cards. The two received the Pfizer booster, despite previously getting the Moderna vaccine.
And when I said we had Moderna, she said it doesn't make any difference.
You know, Pfizer is the only one that's approved for booster, but it should not be given to individuals with Johnson & Johnson and Moderna at this time.
According to Dr. Kim Onufrak, current guidelines from the CDC and FDA say not to mix the vaccinations. As far as the effects of mixing them, she says the jury is still out.
We don't know yet. There's not a whole lot of data. There's current studies going on right now, but we don't have any data currently to know what the safety and efficacy is of mixing vaccinations.
So who is eligible to receive the Pfizer booster? Well, those who have had Pfizer as their first 2 shots at least 6 months ago and fall into one of these groups. People 65 and older, nursing home residents, and assisted living residents. Others ages 50 to 64 with a long list of risky health problems. CVS Health responded to our request for comment, saying, while we cannot disclose information about an individual patient, per CDC guidance for a 3rd dose for immunocompromised patients, if the mRNA vaccine product given for the first 2 doses is not available or is unknown, either mRNA, COVID-19 vaccine product, Moderna, or Pfizer may be administered. Both JD and Betty confirmed they are in fact immunocompromised. Still, according to Dr. Onufrak,
3rd dose Moderna, it's only approved for immunosuppressed individuals at this time, but they should have received Moderna.
JD and Betty Doff say they are now left to wonder what's next.
Sit around and wonder, am I protected? Is it what's going to happen after a year of them mixing together? And
now tonight, Dr. Onufrak says she hasn't heard of any adverse effects of mixing the vaccines and says most likely the couple will not need another dose of Moderna. She also said it's important to know what kind of vaccine you received, and if you have any questions about whether you qualify for the Pfizer booster, to consult your doctor. The couple says they are feeling just fine tonight. Rudy?